Did you know that the way you are sitting on the toilet right now might be physically blocking the exit of your stool, creating a knot in your bowel that forces you into dangerous straining? And what if I told you that drinking water the wrong way could be practically useless for your gut, serving only to fill your bladder and make you run to the washroom to urinate, without hydrating the fecal matter that is stuck at all? There is a mechanical and physiological blockage that the vast majority of people, especially after the age of 50 or 60, completely ignore. This lack of knowledge is responsible for a large part of the chronic constipation problems, hemorrhoids, and even cardiovascular complications we see today. In the next 24 hours, you can radically change the health of your digestive system and your vitality if you understand exactly how to unblock this mechanism. There is a silent and dangerous sensation that many of us end up normalizing as the years go by. It starts with that constant feeling of heaviness in the lower abdomen, the bloating that makes your clothes, which fit in the morning, become tight and uncomfortable by the end of the day. It is the terrible certainty that, even after going to the bathroom and straining, you haven't emptied everything you needed to. You leave the bathroom tired, frustrated, and with the feeling that you are still carrying dead weight inside you. This is not just a normal discomfort of aging or something you need to resign yourself to and live with. It is your body sending a red alert, screaming that traffic has stopped and that toxins which should be out of your body are being reabsorbed by your bloodstream, slowly poisoning you day after day. Ignoring these signs can lead to consequences that go far beyond bad moods, irritability, or momentary discomfort. We are talking about real risks. For us, who have passed a certain age, excessive straining to evacuate is not just painful, it is dangerous for the heart and the brain. But the good news is that, before this video ends, I will reveal the clear signs your body gives that should never be ignored. And most importantly, I will give you a detailed, simple, and practical protocol that does not require expensive medicines, dubious miracle teas, or complex equipment. It is a method capable of unblocking your gut and bringing real relief between 24 and 48 hours. I am Klaus Hoffman and welcome to Senior Health. Here, we treat your health with the depth, respect, and seriousness it deserves. If you want to protect your future, understand how your body works, and live with more vitality here in Canada, consider subscribing to the channel right now. Let's take care of this together, step by step. To solve this problem once and for all, we need to stop treating the bowel as if it were just a dirty pipe that needs to be washed by force. The digestive system is, in fact, a masterpiece of hydraulic, chemical, and mechanical engineering. Imagine a garden hose through which water and waste need to pass. If that hose is kinked at some point, or if the material inside it is dry like cement, no matter how much pressure you apply, the flow will be interrupted. The human body works in a very similar way. What happens inside you when you feel that bloating and difficulty evacuating is not laziness of your bowel? Often it is an operational error in how we are living and using this biological machine. We live in a modern society, surrounded by comforts, but our body is still biologically the same as our ancestors from thousands of years ago. The design of the modern toilet, the one we have in every bathroom in Canada, was created thinking about the comfort of sitting, as if it were an office chair, but it is anatomically disastrous for the act of evacuation. I will explain why, and this is fundamental for you to understand the solution. There is a very important muscle called the puborectalis. Its function is to maintain continence, that is, to prevent you from defecating at inappropriate times, like when you are walking or standing. It works like a loop that pulls the rectum and creates a curve, a closed angle that blocks the passage. When we sit on the traditional toilet, with our knees at the same height as our hips, forming a 90-degree angle, this puborectalis muscle does not fully relax. It remains partially tensed, maintaining this curve at the end of the bowel. You are, literally, trying to force the passage of something solid through a door that is half closed. It is a fight against your own anatomy. And this is where the silent danger lies that few doctors explain with the necessary emphasis. Upon encountering this physical resistance, what do we do instinctively? We strain. We hold our breath and push with our abdomen. In medical terms, this is called the Valsalva maneuver. When you do this, the pressure inside your chest and abdomen skyrockets. This compresses the large veins that bring blood back to the heart. Blood flow decreases momentarily and, when you release the air, the blood rushes back violently. For a young person, this might be nothing. But for us seniors, this sharp fluctuation in pressure can be dangerous. It can cause dizziness, fainting in the bathroom, and in extreme cases of vascular fragility, increase the risk of cardiac events or strokes. Furthermore, this excessive mechanical pressure is the #1 cause of hemorrhoids and anal fissures, which make the act of going to the bathroom an experience of fear and pain, creating a vicious cycle where you avoid going to the bathroom to avoid pain, which dries out the stool even more. Another critical point is what happens chemically when feces remain stationary in the colon for too long. The large intestine functions to reabsorb water and minerals. It is very efficient at this. If the fecal matter stays parked there for days, the bowel keeps sucking water out of it. The result is hard, dry feces, similar to stones, which makes evacuation even more difficult. But it is not just water that is reabsorbed. Toxins, hormones that should have already been excreted, such as excess estrogen, and byproducts of bacterial fermentation return to the circulation. This is what we call auto-intoxication. That is why, when you are constipated, you don't just feel a heavy belly, you feel mental fatigue, that brain fog, irritability, headaches, and even skin problems. Your liver gets overloaded attempting to filter the garbage it had already sent away once again. Let's identify now the signs your body is emitting that perhaps you are not relating to the bowel. The first sign, and very common, is bad breath that doesn't go away with brushing. Gases absorbed in the bowel can be exhaled by the lungs. The second sign is lower back pain. Often, the full bowel compresses nerves and structures near the spine, causing back pain that you think is muscular, but is intestinal. The third sign is a lack of appetite or mild nausea. Your system is full and signals to stop eating. And the fourth classic sign is the need to use manual maneuvers or constant position changes to manage to finish evacuating. If you identify with this, take a deep breath, calm down. The good news is that, in the vast majority of cases, about 90% of functional constipation, the problem is totally reversible with strategic adjustments of mechanics and food chemistry, without needing to resort to surgery. We don't need to reinvent the wheel, we just need to align our habits with our body's biology. Now, pay close attention. Let's get into the practical plan. Grab a pen and paper if you need to, as this protocol can change your morning routine forever. It is divided into 4 pillars: hydration, chemistry, mechanics, and movement. Pillar number 1. Impact hydration. Many people here in Canada walk around with their water bottles and sip small amounts all day. That is great for cellular hydration, but insufficient to move a locked bowel. To wake up the colon, we need volume and temperature. The protocol requires you to drink between 300 to 500 milliliters of warm water right upon waking, on an absolutely empty stomach. Why warm? Cold water causes vasoconstriction, closing the capillaries of the stomach. Warm water relaxes the muscles and dilates the vessels. And why this amount all at once? To activate the gastrocolic reflex. When the stomach distends rapidly with the entry of water, it sends an immediate electrical signal via the nervous system to the large intestine, ordering, empty the lower compartment because a new load is arriving. It is like pressing an internal flush button. Extra tip: if you don't have gastritis, squeeze half a lemon or add a tiny pinch of sea salt to this water. This transforms simple water into an electrolyte solution, which is absorbed better and helps pull water into the bowel by osmosis, softening the stool. Pillar number 2, smart food chemistry. For decades we heard that fiber is good, so people buy wheat bran or eat raw oats and drink little water. The result? The bowel locks up even more, as if it had cement inside. We need the right fibers and the right enzymes. Forget the myth that papaya is the only solution. Current science points to a superior champion, the kiwi, specifically the green kiwi. A major study conducted in New Zealand showed that consuming 2 kiwis a day is more efficient than psyllium for many patients, and without the side effects of excessive gas. The secret of the kiwi is not just the fiber. It is an enzyme called actinidin. This enzyme breaks down the proteins we ingest, like meats and dairy, and facilitates gastric emptying. Additionally, kiwi fiber has a huge capacity to retain water, keeping the stool bulky and soft. The protocol suggests eating 2 kiwis in the morning or as an afternoon snack. If you can wash them well and eat them with the skin, those varieties with smooth skin or gold, or even the fuzzy one if brushed, the prebiotic effect doubles, feeding the good bacteria that regulate transit. Another powerful tool is the prune, but used the right way. Eating prunes straight from the package can cause a lot of gas. The secret is hydration. Leave 4 or 5 prunes soaking in a glass of water overnight. In the morning, eat the prunes and drink the brown water. This water is rich in sorbitol, a natural sugar that the body doesn't digest well and that attracts water into the bowel, softening everything that is stuck there. Pillar number 3, mechanical correction, the game changer. This is the simplest step and the most ignored. We need to correct the angle of the rectum. You don't need to renovate your bathroom. All you need is a stool, a step, or a firm support for your feet, about 15 to 20 centimeters high. The goal is that, when sitting on the toilet, your knees are higher than your hips. When you elevate your knees, simulating the squatting position, the puborectalis muscle relaxes completely. The angle of the rectum goes from 90 degrees to about 35 degrees. The channel becomes straight. Gravity starts to work in favor of evacuation. You will notice that the need to strain decreases drastically. For many, just this change in posture is enough to solve years of constipation. Besides elevating your feet, lean your torso slightly forward, resting your elbows on your knees. This is the perfect anatomical posture. Pillar number 4, the end of irritant laxatives and the entry of calming ones. If you use senna or cascara sagrada teas regularly, stop right now. These are stimulant laxatives. They irritate the lining of the bowel to provoke spasms. Over time, they destroy the nerve plexuses of the bowel, causing melanosis coli, which leaves the bowel dark and paralyzed. You become dependent. Without the tea, the bowel doesn't work anymore. Swap this for fennel tea or chamomile. Fennel is a natural antispasmodic. It helps eliminate trapped gases that cause colic pain and relaxes the muscles so that the movement is coordinated and not convulsive. Bonus: lightness, massage and breathing. Often, the bowel needs an external stimulus. There is a simple technique called the ILU massage, ILU, which follows the shape of the colon. Lying on your back, you make firm circular movements starting from the lower right side of the belly, where the colon begins, going up to the ribs, crossing to the left side and going down. You are drawing the path of the feces with your hands, mechanically stimulating peristalsis. Doing this for 2 minutes before getting out of bed can work wonders. Combine this with diaphragmatic breathing. Instead of holding your breath and pushing down, the dangerous error I mentioned, inhale by puffing out your belly and exhale by relaxing the anus. Training the relaxation of the pelvic floor is more effective than straining. Let's also talk about what might be sabotaging all this effort: medications and thyroid. Here in Canada, hypothyroidism is very common, especially in women over 50. If the thyroid is underactive, the entire metabolism slows down, including the bowel. If you do everything right and nothing works, ask your doctor to check your TSH. Additionally, blood pressure medications, calcium channel blockers, iron supplements, antacids with aluminum, and antidepressants are notorious for causing constipation. Do not stop taking them, but talk to your doctor about alternatives or dietary adjustments to compensate for this effect. To apply this in your daily life, let's structure the perfect morning ritual. Upon waking, drink your 500 milliliters of warm water, with or without lemon. Breakfast: include the 2 kiwis or the hydrated prunes. Avoid white bread and dry crackers, which act like glue in the gut. Prefer cooked oats, porridge, which are rich in soluble fiber and form a lubricating gel. The moment when you feel the first urge, do not postpone it. Go to the bathroom. Use the stool under your feet. Do not take your cell phone or newspaper. Distractions hinder the brain-gut connection. Breathe deeply. Relax your belly. Give your body time, but don't stay there straining for 20 minutes. If nothing comes out in 5 minutes, get up, walk a bit, and try later. Movement. The bowel needs rocking. A 20-minute walk after meals helps food move. A sedentary lifestyle is constipation's best friend. Remember, consistency is key. Your bowel may take a few days or even weeks to trust this new protocol and relearn how to function on its own, especially if you have used laxatives for years. Have patience and compassion for your body. It wants to work. It just needs the right tools. This protocol gives control back to you. It is not normal to live bloated, grumpy, and afraid to eat. Your body is a resilient machine. By applying impact hydration, the enzymatic nutrition of kiwi, and postural correction, you are removing the barriers that prevented health from flowing. And now, I have a mission for you. I want you to choose one of these tips to start tomorrow. Will it be the warm water, the stool, the kiwi? And I want to know, did you already know the importance of posture on the toilet, or did you always sit normally? Answer in the comments. Your experience helps other people see that they are not alone. If you suffer from gas or bloating and watch this far, type the phrase "free gut" in the comments. That way I will know that you are part of the select group that really cares about health and sought complete knowledge. If this content was useful, please click the like button. This tells YouTube that this is a video of public utility and helps show it to more Canadians who need this information. Subscribe to the Senior Health channel and turn on the notification bell so you don't miss our next videos on longevity and natural health. Take good care of your body. It is the only place you have to live. A big hug and see you in the next video.